Well, I think it's interesting that throughout these years, when I talk to different people would have different ideas or concepts of what integrative medicine is. And I think, I find out that in one end of the spectrum, people is thinking using Chinese medicine as an adjuvant or an adjunct or supplementary to the mainstream Western medicine. And the other end of the spectrum is some people is thinking about a convergent system that merge the two Chinese and the Western system together to have a so-called new medicine. So and then in between there are so many different things can happen by combining the two, particularly combining the technology or the techniques used in different modalities. So I personally believe this is a progressing the stages there, and it's just like a moving target. So I think to different times and for people at different places.
I agree. I think that it's a process, it's a continuum, so that it really represents a diversity of approaches.
Well, if I could jump in, actually, I actually listen with very much interest in the philosophy of the integration. But the way that, from a simplistic clinician standpoint, the way I look at it actually is that we've had integration for quite some time, but at one time, for example, we have surgery, we have medicine, and both surgery and medicine could be used to treat diseases like ulcer and things like that. And yet we now have pretty well integrated both medical treatment and surgical treatment. So in the same way, I suspect that the TCM sooner or later would actually become part mainstream and become, in fact, a department or division within the department. And I suspect that we might actually not be talking about TCM complementing Western medicine. We might actually be talking about both systems actually complementing each other, very similar to medical treatment complementing surgical treatment and surgical treatment complementing medical treatment, etc.
But I a little bit disagree with you, because I think that what you're talking about is kind of looking at Chinese medicine as a specialty or as a technique, just like surgery and medicine. I think integrating Chinese and Western medicine basically is a merger, it's a blending of looking at the continuum of cultural approaches in terms of their thinking towards healing, and so it's sort of a little different. I agree with you that at least within the Western world, people are thinking about, well, maybe let's have a department of complementary alternative medicine as a division. But I think that this would be a little bit more narrow sense of thinking about integration.